this 5-minute glute routine in bed every morning before getting up. You may not know this, but weak glutes are one of the leading causes of chronic knee pain, lower back instability, and falls in adults over 50. When these muscles are not working as they should, your spine and knees absorb loads they were simply not designed to handle, accelerating joint wear in a progressive and silent way. A study published in the Journal of Orthopedic Research revealed that adults with low gluteus medius activation have a 58% higher chance of developing severe patellofemoral knee pain, one of the most common complaints in people over 50. And the worst part? Most people do not connect the aching knee to the glutes that are not working properly. Most older adults, when they think about strengthening their body, automatically focus on their arms, quadriceps, or calves, and the glutes are completely forgotten. That is why today you will learn a routine of 5 simple exercises done right in bed, before you even get up. No equipment, no time excuses, no need to go anywhere to put an end to this problem and save you from the pain. Exercise number 1. Glute bridge with march. The glute bridge with march is a direct evolution of the static bridge and represents one of the most complete exercises for adults over 50 because it combines gluteus maximus strengthening with pelvic stability training during asymmetrical movement. This is exactly the muscular activation pattern required with every step you take when walking, climbing stairs, or simply getting up from a chair. Before getting into the execution, it is important to understand something most people do not know. The gluteus maximus is the largest muscle in the human body. When it functions at full capacity, it acts as a true central shock absorber for the entire posterior chain, protecting your spine, hips, and knees. The problem is that especially after 50, prolonged inactivity and hours of sitting cause the gluteus maximus to enter a state that specialists call gluteal amnesia, where the muscle simply stops contracting efficiently during everyday movements. It is there, but it is not working as it should. The good news is that exercises like the bridge with march are highly effective at reversing this process and restoring proper muscle recruitment. To perform it correctly, lie on your back with your knees bent and your feet resting on the bed at hip width. Contract your glutes firmly, raise your hips until they form a straight line between your shoulders and knees, and then without letting your hips drop or rotate to either side, slowly lift one knee toward your chest, return the foot to the bed, and repeat on the other side. The leg movement should be alternating and controlled without rushing. A valuable tip is to place your palms lightly over your hip bones during the exercise to detect any unwanted tilting or rotation. You will know you're doing it correctly when you feel a slight burn in the glute on the supporting side, while the opposite knee rises. The main errors to avoid are letting the hips drop or rotate toward the side of the rising leg, and performing the movement too quickly, stealing the time under tension that is precisely responsible for the more intense activation of the gluteus maximus. When the hips drop, the exercise loses much of its efficiency and also creates a compensatory pattern that overloads the lower back. If you notice any tilting, reduce the range of motion until you have full control before increasing it again. Perform 3 sets of 10 alternating repetitions per side, resting 30 seconds between sets. For progression, once the movement is fluid and controlled, progress to 4 sets or reduce the rest interval to 20 seconds. This exercise is not recommended for those with acute sacral pain or severe sacroiliac joint instability. In those cases, it is best to return to the conventional static bridge until cleared by a health professional. Exercise number 2, frog pump. The frog pump is probably the most underestimated glute exercise. It has very low joint impact and very high efficiency for the gluteus maximus, making it especially valuable for people over 50 because it allows intense muscle activation without any compression on the knees or lower back. Think of it this way: you can activate the largest muscle in the body with an intensity comparable to a weighted squat without placing a single pound of load on your joints. That cost-benefit ratio is hard to beat on any exercise list. To perform it, lie face down with your legs bent outward, joining the soles of your feet together in the frog position with the soles in contact. Contract your glutes with intensity and slightly raise your hips, just a few inches, keeping your core lightly activated to protect your lower back. The movement is small, but the contraction should be intense and conscious with each repetition. Add a 1-second pause at the top to maximize muscle recruitment. This isometric contraction technique significantly increases the muscular stimulus without adding any complexity to the movement, and is especially useful for those who want to maximize results in just a few minutes of training. The main errors to avoid are using the lower back muscles to raise the hips instead of the glutes, and spreading the soles of the feet too far apart, losing the frog position that is fundamental for the exercise to work. If you feel pressure or discomfort in the lower back, reduce the range of motion even further. The goal is never to go high, it is to contract with quality. Perform 3 sets of 15 repetitions, with a 1-second pause at the top of each movement and 30 seconds of rest between sets. This exercise is contraindicated for people with knee pain and deep flexion or hip impingement syndrome. In those cases, consult a physical therapist before including it in your routine. Exercise number 3, Figure 4 stretch. Have you ever wondered where that feeling of deep stiffness in your hip comes from right when you wake up, as if your joints need a long warm-up before they can function at all? That feeling is not normal or inevitable, even after 50. In most cases, it originates from a specific muscle that almost no one knows by name, the piriformis. This deep muscle, located inside the glute, becomes chronically shortened in people who spend many hours sitting, and when it is tight, it compresses the sciatic nerve, causing everything from localized discomfort to that pain that radiates down the back of the leg. The Figure 4 stretch is one of the most prescribed in contemporary physical therapy precisely because it targets this point with precision in a safe, efficient, and completely accessible way for anyone, regardless of their fitness level. To perform it, lie on your back with your knees bent and your feet resting on the bed. Cross your right ankle over your left knee and, very importantly, flex your right foot to protect the knee and keep it stable. Gently pull your left thigh toward your chest with both hands, or use a rolled towel around your thigh if your reach is limited. You should feel a deep stretch in the glute on the crossed side. To maximize the effect, add small isometric pulses. Gently push the crossed knee outward for 3 seconds and then relax to deepen the stretch. This technique activates the reciprocal inhibition mechanism, causing the muscle to release much more easily than simply holding a passive position. The most common mistake is holding your breath and forcing the stretch abruptly, which activates the muscle protection reflex and causes the muscle to contract instead of relax. The ideal approach is to ease into the position calmly and deepen the stretch only on the exhale, progressively and without rushing. Hold each side for 45 to 60 seconds, performing 2 to 3 repetitions per side before switching. This is contraindicated for those with a hip replacement without specific medical clearance for mobility in external rotation. Exercise number 4, Pigeon pose. It completely eliminates the knee load and axial spinal compression while preserving all the benefits for the deep hip rotators. A study from the Journal of Orthopedic and Sports Physical Therapy demonstrated that stretching the deep external hip rotators, which is exactly the target of this exercise, reduced the frequency of chronic lower back pain episodes by 48% in adults, over 8 weeks of daily practice. 8 weeks of a stretch in bed every morning with that level of impact on chronic lower back pain. This shows how simple consistency can surpass any complicated solution. Pigeon reaches a broader set of deep external rotators, such as the obturator internus, the gemelli, and the quadratus femoris. It is as if the Figure 4 is localized maintenance, and the supine pigeon is a full overhaul of all the rotator muscles of the hip. For the body over 50, which tends to chronically accumulate tension in this region, this difference in breadth is very significant for the quality of relief obtained. To perform it, cross one leg completely over the other. This creates a deeper and more intense hip opening. Completely relax the glutes on the cross side and let gravity do all the work, without trying to force anything with active effort. Over time, as the muscle progressively releases over the weeks, you will notice the crossed leg naturally descending closer to the bed, indicating a real increase in mobility. The main mistake is tensing the body in an attempt to assist the stretch by actively pressing the crossed leg downward with your hand or contracting other muscle group. This produces the opposite effect, because the nervous system interprets forced pressure as a threat and contracts the muscle in response. The key to this exercise is conscious surrender to the weight of your own body, something that can be challenging for people used to actively controlling every movement. Stay on each side for 60 to 90 seconds, breathing deeply and without rushing, and repeat twice per side. This is contraindicated for people with a history of hip dislocation, severe femoroacetabular impingement syndrome, or total hip replacement without express authorization from an orthopedic surgeon. Before we continue, if you're over 50, take a look at this statistic. According to the WHO, between 28 and 35% of people over 65 suffer at least one fall each year. More than 70% of these falls happen inside the home. And today, falls are the leading cause of loss of independence among older adults worldwide. Many people blame it on bad luck, but in reality, it comes down to a lack of strength, balance, mobility, and physical preparedness. That's why our team created biological armor, a complete protocol for people in their 50s, 60s, or 70s who want to make sure they never go through that. Inside the protocol, you'll get a special home exercise program designed to build functional strength, real balance, and reverse years of poor posture and physical neglect without damaging your joints. You'll also learn the habits scientists have identified as common among the populations with the highest life expectancy in the world, habits that less than 1% of the Western population actually practices. Access it now by clicking the pinned link in the first comment of this video, or by pointing your phone's camera at the code appearing on the screen. Exercise number 5. Clamshell. The clamshell is perhaps the most important exercise in this routine when it comes to fall prevention and safety in daily movement. It isolates the gluteus medius with surgical precision, which is the muscle directly responsible for keeping the pelvis level during walking. When this muscle is weak, the pelvis tilts laterally with each step, creating a compensatory chain that overloads the knee, stresses the lower back, and progressively compromises balance. This process happens in a completely silent way without immediate pain until the accumulation becomes impossible to ignore. Strengthening the gluteus medius is not just a cosmetic question of making your hips firmer. It is a fundamental decision for health and autonomy in the years ahead, especially because the gluteus medius also plays a central role in stabilizing the trunk during rotational movements, meaning its strengthening improves practically any daily activity. A systematic review published in the British Journal of Sports Medicine found that progressive strengthening of the gluteus medius reduced the risk of falls by up to 40% in participants over 65 in a 12-week program. 40% with a lying down exercise with no equipment whatsoever. This has a direct impact not only on physical safety, but on the confidence to move freely in everyday life. To perform it, lie on your side with your knees bent at 45 degrees, legs stacked and heels together, keeping the pelvis absolutely still with your navel pointing forward and your heels in constant contact. Raise your top knee toward the ceiling to your comfortable limit. Hold for 1 second and lower with full control. The movement should be small, precise, and deliberate. To check that the pelvis is still, place one hand on your top hip during the exercise. Any perceptible rotation indicates that you are exceeding your current gluteus medius limit. You will know you are doing it correctly when you feel a firm contraction exclusively on the side of the glute, not in the lower back or the inner thigh. The main errors to avoid are letting the hip rotate backward during the lift, which transfers all the effort to the lower back and cancels the benefit for the gluteus medius, and separating the heels at the start of the movement, which equally compromises the isolation of the target muscle. Perform 3 sets of 12 repetitions per side, with full focus on pelvic stillness and control during the lowering phase. For progression, once the movement is completely fluid and controlled, move to 15 repetitions per set or 4 sets. There are no significant contraindications for the healthy population over 50. In cases of active trochanteric bursitis, the exercise should be paused until the inflammation has fully resolved before resuming. Now, to close your morning routine in the best way possible, we have a special bonus exercise, knee to chest hug. If the 5 previous exercises were the active work of your morning, the knee to chest hug is the gift you give your body before finally getting up. It closes the routine perfectly for a very concrete reason. While the previous exercises activated and strengthened the glutes, this last one stretches and decompresses everything that was worked, preparing the body for the day with much more ease than waking up and simply jumping out of bed. Its mechanism of action is dual and extremely efficient. On one hand, it stretches the gluteus maximus to its full length, directly complementing the work done in the previous exercises. On the other, it opens the space between the lumbar vertebrae, relieving the disc compression accumulated over hours of sleep in a static position. It is like gently decompressing each vertebra before placing the body's weight on them for the first time in the day. A study published in the Spine Journal found a significant 55% reduction in the intensity of chronic lower back pain in participants who performed this stretch daily for 4 weeks without any other intervention. Just this stretch every morning for 4 weeks. For people over 50 who face morning stiffness or recurring lower back discomfort, this simple gesture can be transformative. Regular practitioners report that the simple habit of including this stretch in the morning routine reduces not only the intensity of pain, but also the amount of time the body needs to function well after waking up. To perform it, lie on your back with your legs extended. Bend one knee and bring it towards your chest with both hands supporting the back of the thigh or the front of the knee, never directly over the kneecap, to protect the joint. The other leg remains extended and completely relaxed on the bed. Breathe deeply, and with each exhale, allow the knee to come a little closer to your chest without forcing. To enhance the effect and also reach the lateral portion of the glute, add a slight rotation. As you bring the knee to your chest, tilt it gently toward the opposite side of your body. This small variation takes the exercise out of the sagittal plane and reaches fibers that the straight movement would not reach, making the stretch much more complete without adding any complexity. The main errors to avoid are lifting your head and shoulders toward the knee, creating completely unnecessary cervical tension, and holding your breath in an attempt to force the movement further, which activates the muscle protection reflex and reduces the effectiveness of the stretch. Keep your head and shoulders fully supported throughout the entire exercise and use your breathing as an ally, not an obstacle. Hold each side for 30 to 45 seconds and perform 3 repetitions per side, alternating sides with each repetition. This is contraindicated in cases of acute lumbar disc herniation or after recent hip or spinal surgeries without medical clearance. If you enjoyed this and want to discover the best bed exercises for strengthening your abs and core, we have a video appearing on the screen right now showing each one in detail. Go check it out, and do not forget to check our biological shielding protocol as well. Thank you for watching all the way to the end, and God bless you, my friend.